Good evening and welcome to Racker's second legislative forum. I see a lot of familiar faces on this call, but for those who don't know my name, it's Dan Brown. I'm the Executive Director at Racker. And tonight I will act as moderator for this forum as we ask questions of our state representatives. They are in the middle of a very difficult state budget season, and this is our opportunity to discuss what priorities are important to the Racker community and specifically people with disabilities and other disabilities that we support. Over the past few weeks, we've asked our staff, board, and constituency to submit questions to ask at tonight's forum. We received a great response to this request, and we'll do our best to address all of those questions and concerns. Unfortunately, we only have an hour for this forum, and we will try to get to all of the topics that were submitted. So let's get started, and I will introduce our legislators. First is Senator O'Mara. Senator O'Mara was first elected to the New York State Senate in 2010 and has been reelected by the voters of the 58th Senate District to 5 consecutive 2-year terms. Prior to the start of 2021 legislative session, Senator O'Mara was appointed as the ranking member on the powerful Senate Finance Committee. He also continues to serve as the ranking member on the Senate Investigations and Government Operations Committee. In addition to his ranking positions on the Finance and Investigations Committee, he serves as a member on the following committees: Codes, Energy and Telecommunications, Insurance, Judiciary, and Rules. He has also served as one of the 5 state senators on the joint bipartisan 10-member legislative commission on the development of rural resources and as a member of the following Senate task forces: heroin and opioid addiction, Lyme and tick-borne diseases, and workforce development. A former Chemung County District Attorney, Senator O'Mara has also served as Chemung County Attorney and as Assistant District Attorney in both Manhattan and Chemung County. He holds a Juris Doctorate from the Syracuse University College of Law and a BA from Catholic University of America. We've worked closely with Senator O'Mara and appreciate his willingness to listen and advocate for people with disabilities, Racker's most important resource, our staff. Next, let me introduce Senator Pamela Helming. She represents New York State's 54th Senate District. Following her college graduation, Pam worked with developmentally disabled individuals in a residential setting. That was the moment that Pam recognized her desire to dedicate her life to serving others. Pam was more than 30 years of private business experience, She has worked in commercial building, regulatory affairs, and land use planning. Her desire to make a difference in the community led to public service, first as a Canandaigua Town Board member, later as Canandaigua Town Supervisor, and now as New York State Senator for the 54th District. As New York State Senator, Pam serves as the ranking member of the Commerce, Economic Development, and Small Business Committee and the ranking member of the Commission on Rural Resources. She also serves on the Agriculture Committee, the Racing, Gaming, and Wagering Committee, and the Housing, Construction, and Community Development Committee. Senator Helming, with experience as a direct care professional, is all too aware of the mismatch between the responsibilities of direct care workers and our ability to compensate them appropriately. We were hoping also tonight to have Assembly person Anna Kellis, our new Assembly person, but they are still in session and then going into conference, and so she will be unable to join us. And so with that, I'm going to ask Emily in just 1 second to ask the first question, but it's no wonder Senator O'Mara and Senator Helming, you guys are busy. It took me a long time just to list out all the committees you're on, let alone the time it actually takes to participate in all those committees. So Emily, would you please ask the first question?
Good evening, Senators. Thank you for all the work that you're doing, and thank you for joining us. My question is that the $1.9 trillion COVID stimulus package is in reconciliation and likely to be signed by President Biden this week. And in that package, New York State is slated to receive $270 million earmarked for OPWDD home and community-based services for folks with disabilities. What do you plan to do to help ensure that all of this money goes to those services and isn't given to other funding needs?
Pam, would you like me to go first, or I will go? I will go first. That's a critical question, Emily, and a critical issue with the stimulus package that's going. I haven't checked the news this evening to see if it passed back through the House of Representatives yet. We certainly expect that it's going to after the action by the U.S. Senate over the last weekend. So that's coming with a lot of resources to states across the country and to local governments. I think New York State is set to receive in excess of $12 billion from the federal government for a variety of sources, of which that $270 million figure for OPWDD is mentioned, and that's critical. And we need to, particularly right now, we're in the middle of our budget process in Albany, which is going to be about $190 billion budget. I think with a budget of $190 billion, we should be able to be doing more for OPWDD and individuals with disabilities of all kinds. In particular, providing for just and adequate compensation for the direct care providers that are so critical to the services being provided to those with disabilities. So, we need to, in this budget process, hold the governor's feet to the fire, make sure that this money, $270 million and hopefully more, gets directed where it's supposed to go. Unfortunately, over the course of the past year, we've seen a variety of types of CARES Act funding that has come from the federal government through the first two CARE Acts, stimulus acts that were undertaken by the federal government. A lot of that went to the state and didn't necessarily get to where it was targeted and directed. And that was all within the governor's control. We have to make sure we have tight language in this budget and make sure that that money gets directed where it's supposed to go. And I think we should be doing more than just that $270 million that the stimulus package is earmarking for OPWDD at this point. So I am there for that, to make sure that that gets done, and I will be keeping my eye on that funding throughout this process to make sure that it does go to where it's intended. And if you are anybody on this Zoom is seeing or hearing otherwise, please reach out and let us know as soon as possible, because we need to hear from those in the field, those that are actually working with those dollars, who are going to receive those dollars, to make sure that they're flowing. And we need to know what's going on so that we can act, so that we can react, and make sure that the money gets to the services that it's targeted to. So thanks for that question, Emily.
Senator Helming, can she unmute? There we go.
I was getting a message that the host had me locked. But, I think Senator O'Mara really gave a comprehensive answer to that great question, Emily. But I would add that, it's always a challenge when we go through this budget process, right? Making sure that not only are the numbers that we're talking about in the right places, but doing a sweep of the language of the budget. Oftentimes there's language that's incorporated into the budget or policy that really directs money to areas where we don't want it to go. I'd also add that since last year, Senator O'Mara and myself, we have been working very, very closely with our congressional representatives so that any money that is earmarked for the state of New York, it is directed to specific locations. And just going back to our budget process for a moment, Senator O'Mara, Dan, as you noted at the start, is the chair of the Senate, or the ranking member of the Senate Finance Committee. He has sat through hours and hours and hours of testimony, has done an amazing job questioning. And last week, the two of us partnered together and we held a 30-day budget amendment review for the members of our minority conference, because it's so important to us, like I said, that we look at what changes the governor has proposed to his budget in terms of not only the fiscal notes, but again, is there any language in there that would sweep money from one area where it was designated to go under certain circumstances to other areas? And we've identified some concerns, which we will continue to address. But again, as Senator O'Mara said, if any of you have areas of concern, you're hearing about changes or any issues, let us know so that we can be sure to address those.
And thank you so much for that answer, which basically says you're going to try to help make this happen. I do want to reemphasize the one point that Emily made. There's actually in this stimulus package 2 streams of money, the 350 billion that are being split between all the states and localities. There's a very separate stream of 271 million that is specifically on home and community-based services for people with IDD. And that's a separate, total separate stream of money coming in through the stimulus package. So thank you for your support on that. And hopefully it won't be grabbed into the general fund, so to speak.
Well, let's certainly hope not, but you know, that's our job in picking the language in this budget apart. Where we are in the process is, you know, the governor comes out with his budget in late January, and then he does 30-day amendments, as Senator Helming mentioned. Those came out about 10 days ago or 2 weeks ago, and we have gone through those and we briefed those as a conference to keep our eye on those. But the next critically important step will be next week, when both the Senate and the Assembly, the majorities, come out with what we call their one house budgets. And it will basically be a budget prepared, one by the Senate and one by the Assembly. And it will be in usually a resolution format. It's not a full detailed budget, but it does indicate and lay out what changes those houses want to see in the governor's executive proposal, and making known their priorities at the time. You know, I liked the sounds of when Pam started out and referred to me as the chairman of the Finance Committee. I wish I would have a lot more to say about this budget, but I'm just the ranking minority member, which certainly gives me direct contact with Chairwoman Liz Kruger, the Senate Democrat Majority Conference, and I have a good relationship with her, and we'll have a lot of dialogue throughout this process. So, you know, I'm looking forward to the give and take and the challenge of wrapping this budget up, which we have to do by the end of March, by April 1st. So it's rapidly approaching, but with the federal stimulus package coming together, and there was significant concerns over budget deficits in the state government that frankly were pre-existing to COVID, but certainly greatly exacerbated by the COVID pandemic, the extra costs with that, and the turn down in the economy and lower revenues than were budgeted throughout this year. So this federal aid, I think, it far exceeds what I was even hoping that we would get from the federal government, to be honest with you. So I think we're going to be in good shape. Also, the revenue forecasts that we look at on determining just how much money is going to be available from the end of this year's budget and what we expect next year's budget. Those numbers are looking really good. So while we have certainly budget issues, this federal money is going to fill a lot of holes, at least for the next 2 years. But, you know, I do always express caution that we've got to keep our eye on the out years as well, because we don't want to build ourselves a cliff that we fall off of 2 years from now. So, but this federal aid, it's a godsend right now, and it's huge.
Well, thank you. So that's exciting to hear, that's for sure. And next up on a question is Joni Groom. Joni?
Hi, thank you, senators, for the work that you have done. Thank you for participating in this forum. And thank you for the work that you will do. Thank you to Racker for including me on this Zoom with people who, quite frankly, are some of the greatest people on the planet are in this Zoom. It's almost bringing tears to my eyes to see many of you. My name is Joni. I am 61 years old. I've been a resident of Ithaca for over 40 years. My position with Racker is as a CSP. I am a community support professional. CSPs provide supports to youth and adults with developmental disabilities to provide opportunities for meaningful inclusion into our community. We are essential workers. We are face-to-face workers. And I think it's fair to say that folks work for Racker because we believe in the mission of Racker and because we have such tremendous compassion for the work that we do. My concern, or the concern, has been and continues to be that our wages don't afford us a sustainable living. One of the outcomes of this non-sustainable wage is having to find other employment. This results in turnover of staff. This has been an ongoing issue and continues to be an ongoing issue. The turnover of staff for direct support professionals. This turnover then can translate into an emotional catastrophe for the children and adults we serve and their families. It takes us months of training, getting to know our families and our beloved kiddos. I'm sending my love right now. And when there's turnover, the families start back at zero. So my question to you, to the senators for this evening is, what will you do to support a cost of living increase for the direct support professionals or an increase in wages for this essential service? Thank you.
Thank you, Joni. That has been a critical issue for a long time. One that our Republican conference, back when we were in the majority, fought for years to make improvements to that. The increase in minimum wage, starting out with a $15 minimum wage for fast food workers, was outrageous and appalling, in my opinion, when the governor pushed that through. If he really wanted to start with an industry that should have living wages, that should have a wage that pays the individual for the work that they perform, such as the direct care providers, he should have started in requiring that minimum wage for those types of workers be $15 before making it $15 at McDonald's. You talk about turnover. This has only exacerbated the turnover issues that you've had. when a direct care provider, when a CNA nurse in a hospital can go to work at McDonald's and bring home more money. That's completely backwards and upside down as far as what our priorities should have been in this state. And we've been working to correct that wrong. Shortly after the minimum wage was put in, the governor had, I think, thinking back, it was about an $80 million cut for reimbursements for providers that would directly impact the direct care workers. We in the Republican conference at the time led the fight to restore that funding over the governor's objections. I forget how many years that was now. They all run together anymore, but it's been 5 or 6 years, I think, since that happened, and we've been pushing for continuing that increased funding to make up that gap so that providers can pay their direct care workers, hospitals can pay their CNAs and the likes a better wage, so the reimbursement is better, so that can be paid. But it needs to be a bigger priority. Those jobs are much more important. I am certainly familiar and aware of the trauma and chaos that's caused when a regular caregiver moves on and takes another job. It leaves that client, sets the client back, as you said in your remarks. I'm well aware of that, and these jobs should be paid enough so that the individuals can afford and maintain a lifestyle to support themselves and their families, so that we don't see this kind of turnover. There needs to be a bigger priority from our government in making sure that happens. And increasing the fast food wage just exacerbated that problem very unnecessarily, and it was a big insult, in my opinion.
Joni, I would just add, look, I lived the situation, right? I was a direct care professional myself for almost a decade. And I feel like the challenges that we have today, it's very sad to me and it's disgusting to me. And it's just, I don't understand how we still have these challenges that we had in the 80s, right? That we don't recognize direct care staff as the professionals they are, the importance of their jobs. One of the things that our conference will be doing is rejecting the deferral of the COLA that's identified in the governor's budget. I think our direct care professionals really came to the forefront during COVID. We saw just how important you are, just how critical the services that you provide are to people. You're vital. I'll do whatever I can to continue to be a strong advocate. We need to make sure that we have the professionals in place to provide the services that are so desperately needed. So fighting back against any cuts to these programs is something that Senator O'Mara, myself, and our conference, we will continue to push back against.
Senators, thank you so much for that support. I really appreciate that. And hopefully we won't be talking about this 2 decades after this, when we go from the 80s to wherever we are now. So let's hope we solve it long before then. Next up is Chris Donovan with a question.
So I just want to do a quick little introduction to the actual question speakers. So Racker continues to prioritize services for our region's youngest children when interventions are most effective and life-changing. And we do so at a significant loss each and every year. Reimbursement for therapies for young children and families have not kept up with costs, and they've actually reduced over time. Believe it or not, early intervention reimbursement is less today than it was back in 2009. With that type of reimbursement formula, it's no wonder that many of our colleagues and other agencies like Racker have decided to stop providing these critical and effective services and supports to children. It's an unsustainable model, and it's really critical for our region's children and families. So I wanted to introduce Andrew Matolo and his parents, Paul and Jen, and they're going to share their personal perspective on this topic.
Thanks, Chris. Good evening, everybody. I'm going to introduce my son, Andrew, and he's going to say hi.
My name is Andrew. I live in Ithaca. I am 10 years old. I go to Fall Creek Elementary School. I love going to the Laurent dance with my family. I went to Whiteface Mountain. I have cerebral palsy. Sometimes it's hard for me to use my muscles. I use this talker to help communicate.
And who did you see today?
Today, I saw my friend Britta Lee,
And what does Britta do?
physical therapist. My dad wants to talk to you more about this.
And before I do, can you let everybody know, how long have you known Britta?
Since you were a
Since you
baby.
were a baby.
Mhm. Do you want to tell
How old were you when you met her? There's a picture of you on the wall. There you are,
how
a
old are
baby.
you in that picture?
You were 2.
2 months.
So Andrew was 2, and he told me today that he was 2, and then you signed the sign for baby to remind me that it was not 2 years old. Andrew's known Britta Lee, his physical therapist, since he was 2 months old. We have been very fortunate as a family to live here at Ithaca and to have received early intervention services since just after you were born. You had a stroke right before you were born, and that stroke resolved right before you were born, and that's where your cerebral palsy comes from. And we have been really fortunate to know Britta, who we still see now as a physical therapist in private practice. And so part of our story tonight is how wonderful it has been to be able to see her and other therapists. And just this year, Andrew started taking some steps outside his walker and be able to balance without his walker. And that's from continuous work with Britta and from all the investment that the state has helped us make and helped make in Andrew to become someone who's on his way to being a very independent and very contributing part of our society. So tonight, Senator Helming, it's wonderful to meet you. Senator O'Mara, I'm not sure if you remember, I sat with you in the Capitol some number of years ago. And so it's wonderful to see you again and not just share a picture of Andrew, but to be able to introduce you to Andrew. Jen and I are really excited to do that. And we thank you for your help. I think that struggle you mentioned might have been right around that time frame when early intervention was under threat some number of years ago. And we're really happy for the leadership you and your colleagues have taken to push back against these cuts. And so the questions we have for you are about these services and other services of the direct support professionals that will continue to help Andrew. Thanks, Andrew.
Andrew's getting the booklet of questions.
And so we'd like to know what steps you can commit to help protect not just the survival of the program like early intervention, but really the growth of it and the fortifying it so that the reimbursement levels can go up and be requisite to what they should be at 2021 levels and not experience the kinds of turnover, especially for our youngest in the community who need these folks the most. And so that's my first question. And then I have a second question, which is really an offer, which is in your work, because I know you've been very successful in helping to ensure these budgets are as best as they can be. Please let us know what we can do to help you in your work in Albany, working on behalf of constituents like Andrew. Thank you.
Well, thank you all. It's nice to see you. And Paul, I think I do recollect you coming in because when your name was announced first by Chris, I definitely recognized the name. So nice to see you again. Andrew, nice to meet you. You do a great job with that communicator there. It's very nice to talk with you. And I'm so glad to hear that you're able to be working on your balance with your physical therapist, and standing up without your walker is fantastic. Keep working hard. Every day counts, and you're going to get better and better. I know. Certainly with that excitement I can see on your face, you're going to achieve everything you can. So it's great, and we're going to work very hard to continue to provide as much support as we can, because early intervention. My hometown of Horseheads, just south of Ithaca, by about a half an hour, is in Chemung County. And long before my career in government, Chemung County was a leader and actually a pilot project county in the state for early intervention services. Probably 30 years ago or so. And they're still providing great services through early intervention. And that pilot program helped develop programs across the state. So that's still going on. I'm a firm believer that the earlier we're able to intervene in an individual's care, the more likelihood of success we're going to have. And it's money well spent. It can lead to significant improvements, which leads to cost savings down the road. So it's a fantastic investment. But to hear that you've been able to have your physical therapist since you were 2 months old is that's phenomenal. And so many individuals don't get that kind of longevity out of any provider that they're seeing. So to live your life from 2 months old to 10 years old, that's a long time. And a lot of good work has been done with you and your therapist, Andrew, and a lot more work will be done. But I think you're able to make the progress you're making today because you did get started as young as you did. And that's great. So thank you for sharing that with us tonight.
I would just add, Jen, Paul, and Andrew, thank you so much for sharing your story. It's wonderful to hear about the positives that are occurring. As Senator O'Mara said, the length of time with your service provider, your physical therapist, is just incredible. Andrew, your smile is absolutely beautiful. I appreciate everything you've done, your hard work to accomplish everything that you've had. That you have accomplished. Taking your first steps is amazing. And I want you to know that Senator O'Mara and I and our colleagues here in Albany, we're going to continue to work just as hard as you are to ensure that you can continue to get the services that you need. You know what? I can see you just continuing in your progress and living the best quality of life that you possibly can and being just as independent as you possibly can. Look forward to talking to you again in the near future.
Thank you, Senators, and Andrew, Paul, and Jen. Thank you so much for coming on and sharing. Andrew, it was very nice for me to get an opportunity to meet you. And next up is Sarah Mcguire. Sarah is a parent of a child, and she'd like to talk to you a little bit about that in our preschool. So, Sarah.
Hi, thank you, Senators, for being here, and thank you to everyone at Recker for having my husband Ben and me here. We are parents to Alice and Rose, and Alice went to the Recker Partnership Program preschool for 2 years. And we still love Recker so much, and we just can't say enough wonderful things about it. So I wondered if Senators, you would speak to why family caregivers do not currently qualify for a COVID vaccine. It's something that we've been trying to get because Alice is very medically high risk, as are most of our kids. And it seems like parents have been left out. And so we were just wondering if you could tell us a little bit more about why that might be.
How do I
Go for it. Go for it. Go for it.
That's a question best addressed to our governor. He has been unilaterally calling all of these shots, taking no input frankly are listening to members of the legislature like us, we have been demanding access to vaccines for just those types of people. I did see something come across today that as of March 17th, there's another expansion of types of people that can get vaccines. I know he's lowering the age from 65 to 60, and there were some other factors in there. I'm not sure if it covers, the care providers that we're talking about here, but it should. I know that Senator Helming and myself and others in our conference in Albany have advocated for the expansion of that. And there were a lot of issues early on with homes, with group homes for the developmentally disabled, similar to the nursing home situation that we're dealing with in Albany now. We're starting to look into this now with the homes, the group homes where COVID positive hospital patients were being required to go back into group homes with the COVID positivity. Those workers should be protected. Those other individuals living in those households should be protected. There were plenty of mistakes made throughout the handling of this pandemic, and I don't criticize anyone for having made mistakes in a pandemic that the world hadn't seen in 100 years. But the way this administration, the executive in Albany, has handled it is basically that he's perfect and has made no mistakes. Hasn't taken any criticism on this well. Has really refused to listen to the legislature throughout the past year on recommendations that we have. We have been trying very hard to terminate the governor's emergency powers that he's had, because we do believe he's abused those powers and has just failed over the last year to really communicate and interact with the legislature on areas that we've been critical of. And this is one of them. And we continue to speak out, and we will continue to speak out. But it's been difficult when one individual has had all the power and refused to listen to others. That needs to stop. The legislature needs to be more aggressive and more assertive in legislative oversight in challenging the governor on certain directions he's gone where we feel maybe he should go another way, such as adding these caregivers to the list. So that has been a big area of frustration for us in the legislature. We're starting to make some progress on that, but we've got a long ways to go.
So I would just add to that, this is an area that is so incredibly frustrating, right? To give you an example of what Senator O'Mara is talking about, the governor having these unilateral controls and not taking any input from the legislature or even from people who are experts in the field. An example, just yesterday, right before noon, I got a call from a pharmacy in Auburn. They had 20 slots available that they couldn't fill. But the way the governor has written the guidelines, he's controlled so tightly who can get that vaccine. So that pharmacy easily had 20 people who came into the pharmacy who would have taken those vaccines in an instant, but they weren't allowed to give them because of the micromanagement of the governor and the commissioner of health. Last Wednesday, I had a conversation with the CEOs for 6 of the small hospitals in my community. Same thing with them. They are begging, relax the requirements so that we can give the vaccines to the people who need them. So it's a constant struggle. It's something that every single day we're sending letters to the commissioner of the health and the governor to expand to certain areas, priority areas. And Senator O'Mara and I and our colleagues were happy to put a letter in, again, calling for the governor to expand vaccines to family caregivers.
Senators, that would be awesome. It seems like we're missing the boat completely when we leave the family caregivers out of our who are caring for our most vulnerable individuals in our society. It just is unconscionable, and your willingness to send a letter in to the governor and the Department of Health would be awesome. And it will help, at least in some ways, maybe push the needle a little bit.
Well, we have sent that letter in. And, I would encourage, into the question that Paul had before, I didn't really expound too much about what more can you guys do as advocates for yourselves. And, it's difficult this year because the capitals, the buildings are still locked down. We're not getting groups of lobbyists coming up. There's no direct care providers lobby day this year. We get theme days all the time. We're having a lot of Zoom conferences. They're not quite as effective as in person, but I'm encouraging everybody to take this advocacy into your own hands and do letter writing, and not just to the governor, what you should do to the governor, but to your local media, letters to the editor, op-ed pieces from individuals that have maybe a little more expertise and understanding of this, or just from the perspective of a family about how important this stuff is. And the more we can get those types of things into our local papers, because believe me, the governor and his staff review every comment about anything, particularly if it involves him. But anything involving state government, they're looking at every local newspaper, whether it's a weekly or a daily, that's out there. And if you can get those types of letters on just the importance of this, and that will show that the community is speaking out, and the squeaky wheel gets the grease. And not that you got to be whining and complaining, but just pointing out just how critical these services are, and just how difficult it is for these care providers to make a living wage. It's difficult. Reimbursements are cut. The governor's still looking at cutting Medicaid reimbursements throughout this year. He just came out with some in his 30-day amendments that are frankly appalling, but hopefully they won't need to happen now because of the stimulus package and the increase in revenues coming into the state. But you know what? You need to make noise. You need to be heard. And that doesn't mean that you have to be in the halls of Albany to do it. You can do it right from home. Do it on social media. Do it to letters to the editor. That stuff does have an impact.
Great. Thank you for that advice. And we will definitely take that tact, especially social media and stuff. Getting things in the paper is a little bit hard because the papers around here are a little thin these days.
Yeah, they are, but wherever you can, you can write one letter and send it to every different outlet. Doesn't need to be a different letter for each one.
Dan, something else that's very effective, especially for people who aren't comfortable necessarily writing, is just do a quick homemade video. Just like you're doing now, share your stories on a video and push it out through social media. It'll get picked up.
Okay. Thank you, Senator Helming. That's great. And I appreciate the advice. And I do want to mention one thing that one of our participants on this forum sent me in the chat. He's found out that New York State mass vaccine sites are allowing unpaid home care workers with a letter from the person that's caring for them. We are aware of families using the unpaid caregiver category, and it works at these New York State mass vaccine sites to get the vaccine. So the person's basically suggesting, don't be bashful, go do that, Sarah.
Yeah.
And Sarah, I was hoping to introduce that beautiful little girl, but she seems to have stepped away.
Thank you. Yeah, that was Alice. She wanted to come and see. She saw her friend Joni especially, and when she heard you talking, Joni, she came right over. So I think she heard your voice. I did want to say that we tried to get a letter from our care manager under the unpaid home health worker, and they wouldn't give one to us. They said that we didn't fall into that category, so we are still without our vaccine.
Interesting.
And I'm not sure that it clearly states anywhere in the guidance from the state that that is an official category, if you will.
Okay.
I'm sorry, Senator, you said it is or it isn't?
So my understanding is it's kind of a backdoor way that people are getting in, right? Sometimes it works and sometimes it doesn't. But if you go to find the guidance that provides direction in that area, there is none. It doesn't exist. It needs to be written.
I see. Okay.
So we'll advocate for the guidance, and also, Sarah, I assume you're using Life Plan Care Manager, so we can also try to look, speak with them and see if there's some avenue for that to be taken care of as well. No guarantees, though. We can try. We can try. That's all we can do. So thank you for that very good, robust discussion on the vaccine for the unpaid family caregivers. And next up is Katie, a question from Katie Boardman. Katie's our director of our residential program. Katie?
Hi there. Thank you, Senators, for being here tonight. You've spoken a little bit about this just now, but what are some steps that we can take as advocates for staff wage increases and increased funding for services? I'm sorry about my coffee. I understand budgets are tight. However, the essential work Racker staff are doing requires a high level of skill, and they deserve a wage that is reflective of that skill, experience, and expertise. How do we make this a reality?
Katie, it's just continued advocacy like you're all doing tonight. I mean, it's got to be persistent, consistent. You got to stay on it, and you need to make noise anywhere and everywhere that you can to build up momentum and to make sure that it is seen on the radars of all legislators in Albany, and including the governor and his staff. But it's keeping this issue alive and continuous attention on the great need for it. And you can highlight just how some of these minimum wage increases have been misguided in the way that they've been implemented to work as a detriment to these categories of workers.
I agree with everything Senator O'Mara said. I mean, join with other organizations, like-minded people, rally, do whatever you can. And like I said, the short videos that you push out on social media, great way to grab attention. The press is always monitoring those and will pick up any stories that they can. And honestly, I mean, it's uncomfortable to talk about this right now, but the governor, he's in hot water, right? He's accused of doing some things that are not good. He's got the whole nursing home scandal, 2 federal investigations underway. It would seem to me that this is a time that he would want to show people that he's a better person than what's being maybe displayed through the media. This is a great opportunity for him, right? Do the right thing, help people with developmental disabilities by providing the funding that they need for the services that are critical to them enjoying the best quality of life possible. I mean, I would pull every punch. I would do everything possible to get the governor's attention and really drive this home. My first year in the Senate was 2017. I think that was the year of the big rallies in Albany, right? I'll never forget the governor. It was probably the first time I saw him in person. One of the big in-person rallies here. He came out of his office with all the security like Rocky and went out there. And I know we had heard what he was going to say, but he got so swept up in the emotion and the energy of all the advocates, right? And he went further, I think, beyond what he even intended. Put that pressure on him now. Remind him of those commitments that he made. Tell him now is the time to deliver. You need this, and you need it now.
Thank you so much for that advice, and we'll continue on that path. I do want to circle back just a little bit on the funding side for the early intervention in the preschool. Chris summarized it nicely that our history as an organization at Racker was started by doing early intervention and supports for children very early on. And it's one of the few areas where there's actual documented research that it saves money over the life of the individual. What Chris didn't say, because she's too kind to say it and I'm not, is that we lose something close to $350,000 a year, every year. The pandemic year is even worse. I don't even want to think about what the number is going to be. But we do it because it's such an important service. Our board, we have some of our board members on tonight, have blessed, authorized, whatever the right exact terminology is to make it happen. But having, early intervention rates that haven't changed since, I think Chris said 2009, and having a preschool funding methodology that just doesn't work for rural school districts providing preschool is just crazy. And I'd love to have some advocacy from you guys on that side as well, specifically a little bit different than the appropriate wage for our direct support professionals, but more on the side of some of these early childhood services. Maybe we can talk a little bit more about that offline. And we're getting to the end of the time period for our legislative forum, and I wanted to give Senator O'Mara and Senator Helming a little bit of time to do a little bit of a closing, maybe 2 or 3 minutes each. That would be great.
Go ahead, Pam. I'll let you go first to close out here.
I want to thank you all for your time tonight, and more importantly, for your work, everything that you're doing to support the Racker Center and children and adults with developmental disabilities. It's so critically important. I know you've been faced with incredible challenges, especially during this pandemic, and I want you to know that I will do everything I can to keep up the fight for the funding that you're owed. It's not only that it's deserved, it's that you're owed. We have seen continuous cuts, continuous challenges. I wonder sometimes, how do you even budget? How do you do your annual budgeting when you don't know from year to year what you can expect to receive? But as Senator O'Mara said earlier in our conversation, our conference has always been committed to doing everything we can to ensure that you get your fair share, and we will continue to do that. If there's anything specific you'd like to talk about, my office is always open. I encourage you, shoot me an email, give me a call. Happy to work with you.
Great. Thanks, Pam. And it's just truly been a pleasure to be with you tonight with Pam. My relationship with the Racker Center over my time in the state Senate has really been a special relationship. I've enjoyed getting to know everybody there and working shoulder to shoulder with trying to improve funding opportunities. The Ithaca, Tompkins County, greater surrounding area is so fortunate to have such a dedicated organization that does just phenomenal work. I mean, you're a real standout in the region on what you're able to do for so many with great needs on really what's always a very difficult budget year in and year out. In this type of work, there's never going to be an easy budget year. There's never going to be a great budget year. I'm committed to continuing my work, as I know Pam is, to improve things from a state aid perspective as much as we can, and we'll just keep chipping away. That's what we do. You're never gonna get a big win in this business of government like Pam and I do day in and day out. We just consistently work to try to chip away and make improvements every year that we can. So we're committed to that, and I look forward to continuing the great relationship that I have with with the Racker Center, and it's just it's great to work with Dan and all your staff. Dan is it's just been a great working relationship over the years, and I certainly pledge to continue to do all and everything that I can to help make improvements.
Sounds good. Thank you, Senator O'Mara and Senator Helming. And Andrew is closing us out with a beautiful wave goodbye. So thank you, everybody. Have a great evening. Thank you for joining us tonight. And Andrew, take care. Alice, if you're around, she's coming into the picture. Yes, she is. Goodbye, Alice. Have a good night. Thanks, everybody. Have a great evening.
Okay. Good night, everyone. Thank you.